Hello everyone, I'm Dr. Niti Krishna Raizada, Principal Director of Medical Oncology and Haemato-oncology at Fortis at Bangalore. Well, cancer is a global pandemic. It is rising in alarming proportion. India is actually called the cancer capital of the world. The number of cancers are rising. We are having more and more westernized lifestyle, which is also adding to our numbers. And of course, the other reason of higher number is early diagnosis. We do more investigations and more scans, and therefore we diagnose cancers often and often diagnose them early as well. Knowing about common cancers adds to our awareness, and therefore we bring ourselves on time. And we know that early diagnosis leads to the right treatment and of course the right results. 50% of all cancers are curable. Quite often they are preventable as well. So knowing things, what cause cancer and what can be prevented is vital importance. Well, we know addictions is the most important thing. Talking about alcohol, talking about smoking, talking about environmental pollution and of course occupational exposure. Certain type of chemicals. Knowing your own family history is another thing. If you have a persistent problem which is there for more than 2 weeks, maybe a constant gastric irritation, maybe fever which is unexplained, having a swelling in any part of the body, bringing out blood from any part, whether it's in cough, whether it's in vomitus or while passing stool, having altered bowel habit, persistent stomach pain, persistent chest pain, persistent cough. These are symptoms note and which should bring you to a doctor. Knowing about common cancers is equally vital. Breast cancer is the commonest cause of cancer in our country. This, even when you combine both genders, men and women, almost 14% of all cancer is only breast cancer. What can you do about it? First important thing is knowing your breast, examining your breast from 20 years of age every once a month. From 30 years of age, every 6 months, a clinical breast examination. From 40 years of age, an annual mammogram, which is an X-ray of the breast. Often, if you have a high-risk family history, an oncologist will assess you, find out if you have a high-risk mutation, and may offer other tests as well, including a blood test and sometimes an MRI of the breast. The second common cancer is head and neck cancer, especially the lip and the oral cavity cancer. What happens if you have a lip and oral cavity cancer? When a painless ulcer, even a small ulcer in the tongue can actually hurt. But when it is cancer, often you have painless ulcers which are persistent beyond 2 to 3 weeks. A self-examination in front of a bright light actually notices any redness, white patches, or even thickening in the mouth, which you should bring to medical attention. Again, India happens to be the hub of head and neck cancer. Especially, we have a large population which chews tobacco, which is the most common cause. Even betel nut chewing can cause. Besides this, a constant irritation from tooth is another cause. These are curable cancer. So please bring yourself to a head and neck specialist or an oncologist who will examine such ulcers, redness or even whitish patch and tell you what can be done about it. The third important group of cancers is gynecological cancers. Cervix cancer was actually the first common cause of cancer amongst women in the past, which has been replaced by breast cancer. However, cervix cancer still happens to be the commonest cancer in rural India, related to personal hygiene, related to multiple partners, and also human papilloma virus, which is now preventable. Just an HPV vaccine starting at 9 years of age to girls and boys both. Up to 45 years of age is recommended. For a younger population between 9 and 14, twice at 0 month and 6 month. When it is beyond 14 years of age, 3 doses of HPV is recommended. Starting from 21, a pap smear, which is done 1 in 3 years, and from 30 years of age in a woman of a reproductive age group, a pap smear combined with a HPV testing done every 5 years is recommended. Endometrial thickness is all what you need to know when you're talking about endometrial cancer or uterine cancer. Now, uterus cancer is often related to obesity, related to comorbidities like hypertension, diabetes, happens often in post-menopausal women which present with spotting or bleeding. These women often will have obesity or sometimes a associated family history of one of the cancers. It could be colon cancer or uterine cancer. doing a routine ultrasound of the pelvis, which actually illustrates the entire uterus and the pelvic structures, and notes an endometrial thickness which could often be more than 4 millimeter, so 5 millimeter or more, with unusual thickening of the endometrium, should prompt you to go to expert, including a gynecologist, who may often ask for a biopsy. Ovarian cancer can often be seen with a family history, where sometimes a transvaginal ultrasound along with a blood test known as a CA-125 is ordered.